For millions, Medicare is a lifeline, especially for chronic conditions like non-healing wounds. But a new policy is set to slash spending on advanced wound care products by an astounding 90%. Doctors now warn this dramatic cost-cutting measure puts patients directly in danger. This isn't just about budgets. It's about a potential rise in infections and even amputations. We'll break down why Medicare is making these changes and what the consequences are for patients. So, why is Medicare taking such a drastic step? It starts with a number that's hard to ignore. Spending on skin substitutes, a key advanced treatment, has skyrocketed. In 2019, it was $256 million. By 2024, that number exploded to over $10 billion. This massive increase signaled waste and abusive pricing. Projections for 2025 showed over $15 billion in spending linked to these issues. In response, Medicare's administrator claims its 90% cut can happen without compromising patient access or quality of care. But is this a surgical strike against fraud or a blunt instrument that will harm patients? Let's look at the new rules that create the danger. The new policy introduces rigid clinical thresholds. Treatments will only be covered if there is specific, peer-reviewed evidence for that wound type. Providers now face strict documentation rules, needing detailed measurements and photos for approval. This isn't just paperwork, it leads to delays. The average Medicare prior authorization already takes more than a week. For a diabetic ulcer, a week is an opening for a limb-threatening infection. These delays don't just happen at the start. Strict rules can interrupt an ongoing care plan. So what happens when a patient's care is suddenly stopped? On top of delays, Medicare is also proposing new limits on care itself. Coverage for skin substitutes could be cut to one treatment a week for only 12 weeks. So we have a system creating delays through paperwork and then capping the treatment allowed. This combination is what specialists find so alarming. This isn't the first time a payment change has had unintended, dangerous consequences. A study on a previous policy offers a chilling preview. When a new payment policy reduced access to long-term care hospitals for severe wound patients, it led to higher readmissions and higher rates of sepsis. This is a clear historical example. Restricting access to specialized care led directly to worse patient outcomes. The same pattern is about to repeat. Medicare also caps the number of total covered visits. This forces doctors to rush treatment or stop therapy before a wound is fully healed. So the policies create hurdles and limit care. But what if you can't even find a doctor to treat you? There's another factor making this situation even worse. The entire system is under financial pressure. Overall, Medicare payments to physicians are set to decrease aggressively in 2026. This squeeze affects specialists most. Faced with lower pay and more paperwork, many wound care specialists are simply opting out. They no longer accept Medicare, creating care deserts. Even proven treatments get caught in this system. Total contact casting, a gold standard for offloading pressure, is still not separately payable by Medicare. So patients face fewer doctors, more paperwork, stricter rules, and less coverage for the treatments they need. How do all these individual pieces, the payment cuts, the rules, the access issues, combine to create the ultimate risk? Let's connect the dots. Remember that 90% spending cut from the beginning? It's the motivation for everything else. The strict documentation, the treatment caps, the payment reductions. We asked what happens when care is interrupted because a patient doesn't fit the new, rigid mold. The answer is simple and brutal. Their wound stops healing. A delay from prior authorization allows bacteria to multiply. A premature end to treatment due to visit caps allows a healing wound to regress and reopen. This is how the drive to cut costs leads directly to the outcomes doctors warn about. It's a direct path from budget policy to an increased risk of amputation. No one disputes the need to control Medicare spending and fight fraud. But the current policy is a sledgehammer where a scalpel is needed. By restricting access to proven, advanced therapies through a wall of bureaucracy, the new policy shifts the cost of savings onto the most vulnerable patients. The price of this policy won't be measured just in dollars saved, but in limbs lost and lives endangered. Patients deserve policies that prioritize healing. It's critical for patients, advocates, and providers to voice these concerns. Contact policymakers and demand an approach that works without sacrificing care.